Good afternoon, ladies and gentlemen. Today I am trying to speak to you from Bangalore, and my topic is periodontitis, a new paradigm. No, periodontal diseases happens to be biggest harm for the mankind. No man is free from it. No race is free from it. Incidentally, it is supposed to be a big scourge upon mankind. And periodontal diseases is a very silent condition and supposed to be associated with many other systemic disorders also, which people are not aware of it. The local causes of periodontal diseases could be associated with microorganisms. And such situations can come that the systemic diseases like coronary artery disease or atherosclerosis, or stroke, or preterm birth weight babies, or even it can lead to associated with increased periodontal diseases and diabetes mellitus. So today I'm going to speak to you in brief how this mechanism of periodontal breakdown takes place. No? Therefore, the whole idea of presentation is to evolve a new concept of biology of periodontitis and describe how periodontitis may influence general health and susceptibility to systemic disorders. As you know, we have an interrelationship between heart and periodontal diseases also. And there are different types of microorganisms dwelling in the periodontal pocket environment, which could be like Porphyromonas gingivalis, Porphyromonas intermedia, Bacteroides, Forsythis, then Actinomycetum comitans, and which are found in the atheromatous plaque. The host responds by increased levels of C-reactive proteins, which is supposed to be a predictor of myocardial infarction. And presence of C-reactive protein in serum and gingival fluid is strong evidence in periodontal diseases as well. The atheromatous plaque may trigger a cascade of results or leading to thrombus formation, and which can be upregulated by cytokines and microorganisms, and thus periodontal disease can break down. Apart from that, the respiratory problems can be ensued because of chlamydia pneumoniae, a respiratory microorganism, which is responsible for not only respiratory problems, but also for heart attacks. And there's a link which is established between the atherosclerosis and even by the cardiopulmonary decisions, and is found by the PCR studies. There could be even situations when you will find that the microorganisms like Streptococcus sanguis and Porphyromonas gingivalis can induce human platelets in the plasma and can lead to thrombosis. Thus, even the organisms like viruses can be associated with the formation of thrombus. Therefore, today, there's an increased evidence of periodontal diseases in atherosclerosis, myocardial infarction, and coronary artery diseases. Now, as a matter of fact, I am trying to give you a picture of how periodontal diseases can be associated with this interplay of microorganisms. The clinical picture observed is a result of the complex interplay between the microorganisms, the shared events, and the disease modifiers. The modifying factors are major inhabitants and determinants of the disease, and they can be observed in different periodontal conditions. They may affect the age of disease onset, pattern of observed bone and tissue destruction, and rate of disease progression, and response to various kinds of therapy, and severance and frequency of disease occurrence. You can imagine how the periodontal disease can break down the situations. Now, this whole story starts with the biofilm, or what is known as a thin layer that's formed on the surface of the tooth surface, and it could be called as a biofilm, and it can be found in different places, in like even in cooling towers, or in food processing, or on the surface of teeth, or in oil recovery, or in ship hulls, and even medical implants and paper manufacturing units, and even in drinking water pipes also. Now, you may imagine that microbially derived sessile community characterized by cells that are irreversibly attached to each other are embedded in a matrix of extracellular polymeric substances that they are produced and exhibit an altered phenotype with respect to growth rate and gene transcription. This nature of biofilm was described by Coglan as a slime city. The base of this biofilm is a bed of dense plaque slime, 5 to 10 microns thickness. It is sticky mix of polysaccharides, other polymeric substances, and water, all produced by bacteria. Now, what happens to this is supposed to be a hydrophobic nature and supposed to attract the planktonic organisms which colonize the chemically inert water lines, and motile bacteria. They come closer to each other, attracted to the lower molecular weight organic matter, and thus you will find there's a contact on the surface takes place, and expression of genes takes place, and that's how we'll find there's a formation of biofilm. And sometimes the sessile bacteria, they divide and form microcolonies and communicate with each other by means of what is known as bacterial porphyrins, pheromones. And there's also a method of communicating with each other, which is known as quorum sensing. And thus you will find that there's a formation of biofilm taking place. So you have a monolayer, then you have got a microarray, then you got a development and maturation, and you find there's a mature biofilm which takes place. This is how the steps are. Now, this biofilm can be disseminated to different parts of the body through the arteries. Now, you will find that the modifying influence may endure life. There are hereditary factors, while others, such as stress and tobacco smoking, may be present, and that can be causing more damage to the periodontal tissues as well. Now, what are we going to talk to you is about the characteristics of biofilms, and that could be associated with ecological communities, and that could permit the survival of community as a whole. And you will find that there is a dominance of lot of bacterial colonies that are present on the surface of the tooth, and that could form a sort of colonization of the bacteria on the surface of tooth. First of all, the gram-positive organisms like cocci comes, and especially the Streptococcus sanguis is the most predominant one in the early part. That is followed by actinomyces on the surface of the teeth. And then you will find these are the initial colonizers. And eventually you will find that the presence of the gram-negative organisms also comes up, like Porphyromonas intermedia or Actinobacillus, Actinomycetum comitans, or it could be in the form of Porphyromonas gingivalis. And even the respiratory organisms like Chlamydia pneumoniae also could be found. So you will find that the whole plaque microorganisms are of different species, different types. And this subgingival microbial complexes could be of different varieties, as we describe here. The red complex is supposed to harness the most dangerous organisms like Porphyromonas gingivalis or Bacteroides forsythus or Tenerella tenticola. These are the ones which are more harmful. As a matter of fact, it's now clear that nearly 750 species of organisms are dwelling in the oral cavity, and a dozen or more of the species have been implicated to one extent or the another in the causation of periodontal diseases. Nevertheless, experts have recently concluded that the three species, especially the gram-negative ones, are supposed to be associated with the periodontal breakdown, as I just now telling you some time back. The growth of the supragingival plaque is a matter of few days, which leads to the association with the gram-negative organisms. And you will find that this plaque microorganisms can bring about an array of acute inflammatory response and manifest in the form of gingivitis. And the biofilms are defined as matrix enclosed bacterial population adherent to each other and to the surface or intersurfaces. Now you can find the organisms like the gram-negative ones or the spirochetes, which are entering into the connective tissue environment. Well, after all of the situations, we'll find that the mechanism of bone destruction takes place as a matter of fact, which could be associated with the greatest number of bacterial products that are present. The gram-negative organisms, especially which are supposed to be having rich amount of lipopolysaccharides, and you will find these biofilms serve as a constantly renewing source of lipopolysaccharides, which once pocket epithelium forms, have a ready to access the connective tissue and then go into circulation. Now, this lipopolysaccharides activate the cells of junctional and pocket epithelium to replicate and secrete inflammatory mediators like interleukin 8, interleukin 1 alpha, and which attract and activate more neutrophils. The activated cells also secrete MMPs, that's what the matrix metalloproteinases, and a large number of organ enzymes which can be degraded, which can degrade, and all the components of connective tissue matrix. These enzymes, especially MMPs, degrade the collagen fibers attached to the root surface, allowing the epithelium to extend laterally and apically, resulting in deepening of gingival pocket. And there is also clinical attachment loss and formation of periodontal pockets. You can imagine a nice looking man, but then having a breakdown to such an extent. And you can imagine there's supposed to be a very nasty one. Of course, you will find the whole thing as the polymorphonucleoleucocytes, they show, diabetes. There's also chemotaxis, and you will find that these polymorphs, they enter into the connective tissue environment, and they can even progress further and go outside the epithelial barricade and enter the sulcus environment or pocket environment also. An inflammatory cell infiltrate could be associated with B lymphocytes or T lymphocytes, and this monocyte macrophage accompanies the periodontal pocket formation. Inflammatory infiltrating the T and B lymphocytes become activated through their encounter with various bacterial antigens and cytokines, and they secrete a large number of cytokines like interleukin 2, 3, 4, 5, 6, 10, or even interferon. Okay, and then these expand the responding T cells clones, and they derive the B cells to differentiate into antibody producing plasma cells. Now you find there's a lot of antibodies present in the pocket environment or the circular environment. The IgM, IgG, IgA are the immunoglobulins which may be produced, and they are predominant antibodies induced by periodontal pathogens, and you'll find the IgG2 class to be more dominating. Of course, as the destruction takes place, you will find the resident and fibroblasts, endothelial cells, and epithelial cells all become involved. And in the presence of non-inflamed gingiva, the fibroblasts produce and maintain collagens and other components of this extracellular matrix and produce high level of tissue damage. As a consequence, the collagen and other components of extracellular matrix are destroyed. The epithelial and endothelial cells similarly participate. In normal, non-inflamed periodontal tissues, the bone formation and resorption are tightly coupled by and exquisitely regulated. Of course, you will find that the destructive periodontitis and the activated macrophages and the fibroblasts secrete prostaglandins. And this prostaglandin PGE2, which induces the formation of large number of osteoclasts and alveolar bone resorption takes place. The interleukin 6, interleukin 1 beta, and TNF, the tumor necrosis factor alpha, also participate, but to a lesser extent than prostaglandin PGE2. Now you will find that periodontitis is not a unidirectional process. the same T cells that produce the destructive pro-inflammatory cytokines and MMPs can also produce mediators that suppress the immuno-inflammatory response. Now, all these functions that downregulate the pro-inflammatory cytokine production, interleukin-4 is produced by T cells, mast cells, and basophils, and is present in the inflamed gingival tissue in very low concentration. And you will find that there could be activation of the macrophages and T and B cells. Well, the risk factors and the indicators of for periodontitis could be associated with tobacco smoking, systemic diseases, the stress, even the advancing age, the race and ethnicity, and the gender, of course, the male susceptible for more periodontal breakdown, the past history of periodontitis, and there could be even the dental care and the hereditary factor, which could be associated with periodontal diseases. Well, among the most important, the environmental causes, you will find the systemic factors associated, maybe tobacco smoking and diabetes mellitus could be one of the causes for this major breakdown. Recent studies subjected to a multivariate data analysis have demonstrated that the bacteria alone account for nearly 20% of risk of our developing severe periodontitis, and tobacco smoking is equally or more important than the disease determinant. Of course, there could be even the relationship of chlamydia pneumoniae, which is associated with atherosclerosis, as I was telling you earlier, and could be even leading to myocardial infarction. Thus, periodontal diseases containing over 700 species with bacteria with terrorists like Porphyromonas gingivalis, chlamydia pneumoniae, and actinobacillus would be a source for coronary artery disease or myocardial infarction or IHD. Among the various factors, you will find that the race, ethnicity, the aging, and of course, the gender also may be a major factor in causing the breakdown. Now, subgingival biofilms constitute an enormous and continuous bacterial load that could be bringing about the breakdown. You will find that in one pocket environment with a single pass of a curate may yield about 107 to 108 bacteria. All three of the periodontal pathogens, like gram-negative ones, could be associated. And the biofilms are very difficult to destroy, and once destroyed, they tend to reform rapidly. Well, the treatment procedures which today we are doing, like scaling and root planing, performed at frequent intervals, can result in bacteremia as manifested by the induction of human immune responses. Such a simple manipulation like toothbrushing or flossing or even chewing can result in bacteremia. Approximately 55% of the patients with severe periodontitis manifest positive arterial blood cultures when chewing with paraffin. So you will find this whole gamut of periodontitis is associated with fibroblast gene activation, and it could be seen both in health as well as in disease. In health, you will find the collagen and the intercellular matrix should be very well protected, and you will find there's a tissue remodeling and maintenance taking place, and there's a good healing and regeneration takes place. Whereas in disease, you will find the production of MMPs taking place that could bring about the damage to tissue architecture. Well, you will find that the periodontium happens to be a reservoir for inflammatory mediators. The pro-inflammatory cytokines like TNF-alpha, interleukin-1 beta, and TFN-gamma, and even prostaglandins reach high concentration in tissues in periodontitis. The periodontium can therefore serve as a renewing reservoir for spillover of these mediators into circulation. The pathogenesis and periodontitis and systemic diseases like atherosclerosis, coronary artery disease, and stroke appears to hold many features in common. Recent findings have been showing that the heart failures are attributed to a hormone which is called as cardiac hormone beta natriuretic peptide. Now, which increases in serum and which could be measured as a single marker in myocardial infarction. So you will try to find that the presence of natriuretic peptide could be even found in the gingival clavicular fluid, which is a great element of a discovery which could take place. You will find when you do a good scaling and root planing, you will find the tissue morphology changes, and you will find there's amount of inflammatory can be reduced to a larger extent. We can say that the life can be more secure and less discomfort, and the longevity of the tooth depends upon our not only surroundings but also in our mouth. The potential microbes could be dangerous, hence we must attend at least once in 6 months to make sure that these unwanted things are very carefully removed and we can prolong the lifespan of the individual. Thank you very much.